Okay, here we are. We're live. I think we're live. Looks like we're live. Okay, so hey everyone, I'm Karen Claffey. Thank you for being here. We'll be starting the webinar in just a few seconds. I just wanted to quickly say the reason I put these webinars together is because I've been learning a lot of medical perspective and anatomy on different conditions. And what I've discovered is in structural alignment yoga therapy, we have many tools and techniques to address many different orthopedic conditions. However, they are completely unknown outside of the yoga therapy circles. So I wanted to share. And so here we are, and I'm going to share my screen now, and we'll start the presentation. Okay. So hopefully you can see my screen now, just making sure. Just making sure. Pausing to make sure. I'm just waiting for, I can see my computer. I'm looking at my computer on another computer, so I'm just waiting to see that my screen is sharing properly because I had a technical issue last time and it did not share. So I'm not seeing anything right now. It's not sharing. Why not? Sharing. Oh, share. I didn't click the share button. There we go. Okay. So now it should show. All right. Okay, I can see it on my other computer. Perfect. Okay, so welcome and thank you for attending today's webinar. I am honored and thrilled to be sharing this topic with you. And I'm going to just make it like that. Yes, perfect. And if you have any questions, use the chat and I will respond at the appropriate time. So today's topic, yoga therapy for structural issues of the spine. Specifically, we're talking about scoliosis, and that medicine has no or relatively no non-invasive cure for, other than bracing and surgery. And whereas we have structural alignment yoga therapy techniques that have proven experientially very effective in addressing these this condition. So this webinar is designed for you if you are a yoga teacher, a yoga therapist, or one of those in training, or a dedicated yoga practitioner, or for those who refer their patients to yoga, including healthcare professionals, body workers, wellness advocates, etc. You're perfect for this webinar if you're passionate about working in a therapeutic capacity and becoming an integral part of your client's self-healing, if you're eager to elevate your hands-on skills and verbal cueing with therapeutic alignment, and you're in the right place if you're ready to transform your personal practice and teaching into yoga therapy and or seeking to specialize in structural alignment yoga therapy. The flow of topics. So first we'll cover the description and the anatomy that's relevant to scoliosis along with the medical treatment approach. Then we will explore the structural alignment yoga therapy perspective, and then third we'll go into the SAYT formula and a few samples of some transformational exercises that have been proven highly successful. If this is your first webinar with me, please check out my first webinar where we discuss structural issues of the feet and knees. And the reason I chose that as my first webinar is because I go into some details about the foundation of the entire posture and how it affects the whole body. And there's some key concepts and principles that are essential to understanding the whole structural alignment yoga therapy approach. And these principles are universally relevant for all conditions, including key differences between the medical, scientific, and the more holistic SAYT approaches. There's some osteopathic principles that are fundamental to SAYT, and we talk a little bit more in depth about the rubber band effect, including the scientific and psycho-emotional factors that are important considerations when working therapeutically with any condition. So first we're going to go over the description and anatomy and the medical approach. So the definition of scoliosis, according to Spine Health, is a condition involving an abnormal sideways curvature of the spine. It can be caused by congenital problems, developmental or degenerative problems, and in most cases are idiopathic, which means an unknown cause, and it usually develops in the thoracic or the thoracolumbar area of the spine. There's what's called functional versus structural. So functional is also called non-structural, which involves a temporary change of spinal curvature, as opposed to what's called structural, in which there's a fixed curve of the bones of the spine. Functional scoliosis or non-structural appears to be caused by a temporary change of the spinal curvature, or an underlying condition such as a difference in leg length, muscle spasms, or inflammatory conditions which may produce muscle spasm. And their functional scoliosis is treated by correcting the underlying problem. The spine itself needs no treatment. Whereas structural scoliosis is considered medically to be fixed, and it often occurs from unknown factors without reference to other physical problems. It tends to affect girls during adolescence, and structural scoliosis can be also part of a syndrome or a disease. The lateral curves of the spine may develop as a single curve, like a C shape, or a double curve, like the letter S. So just for fun, I'm going to ask everyone, take a moment to think, which type of scoliosis do you think will be less symptomatic? Meaning, which one will have less aches or pains or less issues? Pause for you to think. And so the answer is the one that is more preferable, let's say, or less symptomatic is the S-shaped curve. And that is because it's compensated. There's a compensation pattern, and whenever the body can compensate itself, there'll be less issues. So the four types of curve patterns are thoracic, and that's the photo on the far left. The lumbar, which is the second photo. You've got thoracolumbar, which is the third picture. So it's a C shape. It's between those two. It involves the two sections. And then you've got thoracic and lumbar, which is the double. And so then we can look at the medical definition a little more in depth. So while a small degree of lateral curvature does not cause any medical problems, larger curves can cause postural imbalance and lead to muscle fatigue and pain. More severe scoliosis can interfere with breathing and lead to arthritis of the spine. Approximately 10% of all adolescents have some degree of scoliosis, though fewer than 1% have curves which require medical attention beyond monitoring. Scoliosis is found in both boys and girls, but a girl's spinal curve is more likely to progress than a boy's. Girls require scoliosis treatment about 5 times as often, and the reason for these differences is not known. So I put a little highlight because from a holistic / structural alignment yoga therapy, or just structural alignment therapy, because I have both for yoga or manual practitioners, we're going to discuss that from that perspective later. So the medical perspective causes 4 out of 5 cases of scoliosis are idiopathic. We'll talk about the holistic SAYT perspective later. While idiopathic scoliosis tends to run in families, no responsible genes have been identified. And children with idiopathic scoliosis appear to be otherwise entirely healthy and have not had any bone or joint disease early in life. So those 2 points we'll discuss a little bit later. Scoliosis is not caused by poor posture, diet, or carrying a heavy book exclusively on one shoulder, according to the medical profession. And then continuing with different unknown idiopathic causes, they go according to age of onset. So infantile curves appear before age of 3, juvenile between 3 and 10, adolescent between 10 and 13, and then adult curves after physical maturation has completed. And then the causes are known for 3 other types that are not idiopathic. So we've got congenital, neuromuscular, and degenerative. So congenital is some kind of abnormal formation of the spine and is often associated with other organ defects. Neuromuscular, so the nerves are not firing towards the muscles that support the spine. And then degenerative is typically with age, and that's affecting the discs and the actual bones themselves. So you can see in the images the aging scoliosis versus the normal aging, a little bit different. So here's an example of the congenital scoliosis where literally the vertebrae have not formed correctly. So as you might imagine, structural alignment yoga therapy will have limited success treating scoliosis with congenital, neuromuscular, or degenerative causes. However, the idiopathic we have great success with. So more causes. Curve progression is greatest near the adolescent growth spurt, and we'll discuss why from the holistic perspective. And scoliosis that begins early on is more likely to progress significantly than scoliosis that begins later. So this is all part of the unknown, and we will discuss our perspective a little bit further on. The symptoms from the medical profession. Okay, so scoliosis causes a noticeable asymmetry in the torso when viewed from the front or back. The first sign is often seen when a child is wearing a bathing suit or their underwear. So you'll see the shoulder, one shoulder higher than the other, or you might see that the hip or the waistline looks different, or the shoulder blade may appear more prominent than the other due to this rotation pattern that's developing. So the treatment decisions are based on the degree of curvature, the risk of progression, and the presence of pain. So here's an example of somebody who from 2002 to 2006, you can see how they progressed significantly in a period of 4 years. Curves less than 20 degrees are usually not treated except for regular follow-ups and just, keeping monitoring. Watchful waiting is usually all that's required in adolescents with 20 to 30 degrees, or adults with curves up to 40 or slightly more as long as there's no pain. And for adolescents or children whose curves progress to 30 degrees and who have a year or more of growth, they may be braced. And the medical profession agrees that bracing cannot correct the curve, but may be effective in halting or slowing progression. Bracing is rarely used in adults except where pain is significant and surgery is not an option, as in some elderly patients. And we'll see how we can treat this without all of these different options that their medical profession is offering. We'll do it naturally. So surgery for idiopathic scoliosis is usually recommended if the curve has progressed despite the bracing, if it's greater than 40 to 50 degrees before growth has stopped in an adolescent, and the curve is greater than 50 and continues to increase, or if there's significant pain. Surgery goals are to correct the deformity as much as possible, to prevent further deformity and eliminate pain. Surgery can usually correct 40 to 50% and sometimes as much as 80%. It cannot always completely remove the pain. So here's an image of the rods that have been inserted surgically. To maintain proper spinal posture before fusion, metal rods are inserted along the spine and are attached to the vertebrae by hooks, screws, or wires. Fusion of the spine makes it rigid and resistant to further curvature. The metal rods are no longer needed once fusion is complete, but are rarely removed unless their presence leads to complications. So spinal fusion, you can see the image of the rods there in the spine. It leaves the involved portion of the spine permanently stiff and inflexible. This is still all the medical perspective we're talking about here. So while this leads to some loss of normal motion, most functional activities are not strongly affected unless the lumbar is fused. So we are going to, again, talk about some of these points. That's the 5th point. And normal mobility exercise and even contact sports are usually all possible after spinal fusion. Full recovery takes about 6 months. And alternative treatments, according to the medical dictionary, numerous alternative therapies have been touted to provide relief and help for individuals with scoliosis, but none, I underline this, none have been proven beneficial in clinical trials. These include massage, physical therapy, and electrical stimulation. Alternatives such as physical therapy, rolfing, or chiropractic manipulation may provide improved flexibility, stronger muscles, and pain relief that cannot prevent or correct, again, I underlined that, the curvature of the spine or its natural progression. So we're going to discuss that in more detail from the holistic / structural alignment perspective, therapy perspective. Although important for general health and strength, exercise has not been shown to prevent or slow the development. We'll talk about that point as well. Just taking a sip of water, excuse me. And it may help relieve pain from scoliosis by helping to maintain range of motion. So we'll talk about that as well. Alternative treatments continued. Aquatic exercise can be helpful, can improve flexibility, posture, balance, coordination, range of motion, and because it increases joint compression, it can lessen the pain. Good nutrition, is also important for general health, but no specific dietary regime has been shown to control scoliosis development. And chiropractic may relieve pain, but it cannot halt scoliosis development and should not be a substitute for conventional treatment. We'll talk about that point as well. And acupuncture and acupressure may reduce pain, but cannot halt scoliosis. So we'll talk about those points later from our perspective. Okay, so here we go. This is the structural alignment yoga therapy perspective. So the medical profession believes functional scoliosis can be treated by addressing the temporary cause, whereas structural scoliosis is fixed and can only be treated with surgery. In structural alignment yoga therapy, we believe also, of course, that functional scoliosis can be treated by addressing the temporary cause, but we believe and know from experience that structural scoliosis is not written in stone and can be treated with success, with the possible exception of the congenital, spinal deformities, the neurological and degenerative cases where there may be limited transformation or very small amount of success. So we're mainly addressing the idiopathic. So the structural alignment view, the basis for the view that structural scoliosis can be transformed is due to two important factors. The first point is the body is a unit. All body parts are interrelated. Any segment of the body being out of alignment will directly and or indirectly affect the whole body. And please check my perspective on why the medical profession does not consider how all body parts are interrelated, which is explained in my first webinar, Yoga Therapy for Structural Issues of the Feet and Knees. And also please check out the interesting and important 3 tenets of osteopathy that are part of the structural alignment yoga therapy perspective. It's also explained in my first webinar, Yoga Therapy for Structural Issues of the Feet and Knees. And in structural alignment yoga therapy and osteopathy, we recognize Wolff's Law. So we talked about this in the first webinar, but I'm just going to highlight it again because I'm going to address it a little bit more differently in this webinar than I did before. So bone in a healthy person or animal will adapt to the loads under which it's placed. And I have the image showing the skeleton, but I have another image that I'll talk about in more depth to show the asymmetries. So if loading on a particular bone increases, the bone will remodel itself over time to become stronger to resist that sort of loading. Bones and soft tissue includes muscles, tendons, ligaments, everything deforms or forms along the lines of force placed upon them. So this is the example I gave, which is a great example. The scapula and clavicle are much further from the humerus than on the right shoulder compared to the left. Also, you can see here the tubercle here on the humerus is far more developed than on the left, and the sternum turns to the right. So there's a greater pull on the right shoulder, which means they're probably right hand dominant, and this pectoral muscle is going to be more highly developed. And that's going to put more load and pull on the bones, and the bones will develop accordingly. So here I have another image because we're going to be dealing more with the spine here. So this is a great way to look at the asymmetry. So if you look at the top line, you can see I did a perfectly horizontal line, and you can see that the transverse process on this 1, 2, 3, 4th vertebrae, from the top, 5, 4, 3, 2, L2. So L2 vertebrae is slightly asymmetrical. You look at the vertebral body, it's a little bit shorter here, it's a little bit longer here. You can see the transverse process is touching the line, whereas this transverse process is not touching the line. And then if you look at the next line that I drew, you can see how on L4, the top of the vertebral body is more high up here compared to here, and you can see that this is above the line and this is below the line. And then here, if you look at the transverse processes of L4, then you can see how this is much more like the butt end is much more square, the butt end is a little bit more slanted and sloped, and it's more narrow in general, and the whole thing's thicker. So you can see from here that there's more developed muscles on the right side, which are pulling and developing the bones more on the right side than on the left. And another thing here, if you look down, you can see the space between the transverse process of L5. The space is different, and this curve here on the sacrum is different than it is here. So this is a bigger gap. This sticks up more. This is closer and more rounded. All these different asymmetries, we are not perfectly robotically right, left, exactly the same, and this is all due to our functional patterns. So now that we have basic concepts of the structural alignment yoga therapy perspective, let's look at those highlighted points above. So scoliosis is found in both boys and girls, but a girl's spinal curve, okay, actually I'm going to just do it. I'm not going to go one by one here. I have it written here. Okay, so scoliosis is found both boys and girls, but the girls develop much more than the boys and need treatment more often, and these differences are not known. So from a holistic perspective and a structural alignment yoga therapy perspective, we understand that it's more likely in women because women have more estrogen, which produces more laxity and more flexibility. Women are biologically designed for reproduction. So we need that flexibility and laxity in our ligaments to allow for that any kind of progression of a baby to move through our body. And we're just naturally designed that way. The female pelvis, this is the second point. The female pelvis is wider, more shallow, and has a larger outlet. So again, for the birthing process, but you can see this is a great image. Here's the female pelvis on the top and the male pelvis at the bottom. So you can see how wider it is on the female, and this is called the pubic angle. So it's greater than 90 degrees. In men, it's significantly less than 90 degrees. And you can see how the sit bones are narrower, and in the women, in the female pelvis, the sit bones are wider. From the superior view, you can see not only is the whole opening much larger in the female pelvis compared to much smaller in the male pelvis, but you can see in the male pelvis, you can actually see the tailbone and the sacrum, whereas in the woman, it's tilted back more. The bottom of the pelvis is tilted back. And then here again, you can see that change of opening. So in the woman, the tailbone doesn't come into the opening as much, whereas in the male, the tailbone and the sacrum comes right into the opening more. It's more closed in general. So the female pelvis's hip sockets are wider set and smaller. So you can see here, this is the female pelvis again on top. And female, now it's reversed in this image. The male pelvis is on top, so you've got the narrow pubic angle, you've got the larger vertebral body, and on the women, you've got the wider base and the smaller body. And then if you look at the actual hip socket where the femur fits in, on the male, it's larger and it's more lateral to the side of the body, and then the female, the hip socket is smaller and it's more forward, which is why we have more range of motion, because the femur doesn't fit so deep into the cup. You could kind of compare it to the cup of the acetabulum itself. You could sort of think of the difference between a bowl and a teacup. The man's is more like a teacup, where it fits deeper in and with smaller sides. And in the female, it's more like a bowl, so there's a lot more play and range of motion. So this is going to lead to more, more mobility in general. The female pelvis has a greater sacral angle. So again, when we saw it from the top, the tailbone was much further back, but now from the side view, this is creating a much more lordosis, because the top of the sacrum tips forward and the bottom of the sacrum tips back more. And so that's the reason why women, because of that flexibility, they are more susceptible, and that torque on the sacrum and pelvis is going to lead to more movement in the spine in general. And then point number 2, so 4 out of 5 cases are idiopathic, and children that appear to be otherwise entirely healthy and have not had any bone or joint disease early in life. So the screening for scoliosis will only pick up gross visual asymmetries like uneven shoulders, a big curve, uneven hips, the protruding shoulder blade, as we saw. The medical screening techniques are not able to pick up minor misalignments. It takes skilled structural therapist that is trained to assess these subtle asymmetries. Third point, curve progression is greatest near the adolescent growth spurt. So we know from structural alignment yoga therapy that during growth spurts, and medical knows this as well, they just haven't sort of put 2 and 2 together. During the growth spurts, the bones grow faster than the muscle length can adapt to. And the bones become misaligned relatively within that confined space. So imagine you have the sac, and it's limited in its movement, and something's trying to grow inside of it. So what's growing is going to have to compress itself. And this is leading to uneven musculoskeletal tension patterns and asymmetry. Then point number 4, scoliosis that begins early on is more likely to progress significantly. So while this is still, unknown cause. So from our perspective, once a postural asymmetrical pattern is established, whether from the womb or post-womb due to other factors, we understand this from the yoga tradition, and these are samskaras. And these are those ingrained patterns that are developing. And there's a tendency for this pattern to become more deeply ingrained unless steps are taken to counteract this tendency and to balance the musculoskeletal system as a whole. And this is continuing that same point. Misalignment in the foundation or in any of the weight-bearing joints may be contributing to compensation in other areas of the body. Musculoskeletal imbalances can lead to scoliosis. And here's the different ways the body compensates. So in the weight-bearing joints, the ankles, if the arches are collapsed, the ankles, the knees, the hips, and then those transition points of the spine where the lumbar spine meets the sacrum, where the thoracic spine meets the lumbar, where the cervical and thoracic, and the cervical and the cranial. Then the 5th point, spinal fusion leaves the involved portion of the spine permanently stiff and inflexible. While this leads to some loss of normal function, most functional activities are not strongly affected unless the lumbar spine is fused. So from what we know from anatomy and from our holistic principles, structural alignment yoga therapy principles, any area of the body that is altered structurally and functionally is going to create compensations in other areas of the body. Future aches and pains will likely manifest above and below the affected section of the spine, such as in other areas of the spine, other areas of the torso, and or the upper and lower limbs. Therefore, it's far more preferable to treat scoliosis with a less invasive natural approach, because of the fact that that fusion is going to lead to other things that they may not even realize. And then point number 6, alternatives such as physical therapy, rolfing, or chiropractic manipulation may provide improved flexibility, stronger muscles, pain relief, but cannot prevent or correct the curvature of the spine or its natural progression. So this statement is in accordance with what's being taught in chiropractic and, from what I've experienced, in osteopathic schools. I've been to 2 schools. I went to one school for 1 year, and now I'm in my 2nd year at another school. So that's 3 years so far of osteopath school. And so I've heard both professors or different professors at both schools say the same thing. Treatment may relieve pain and improve musculoskeletal functionality, but scoliosis cannot be reversed. So when I heard my professor, my current professor, osteopathy professor, make this claim, I raised my hand in class, knowing full well that in structural-based yoga therapy, we've been successfully reversing scoliosis for years. I didn't say that to him because I know they don't know about this. And I asked him, if we can affect change in the surrounding soft tissue as well as the interspinal ligaments, this is osteopathically speaking, then based on Wolff's law, can we not then alter the skeletal structure gradually over time? He seemed a little surprised at my question, but he nodded with approval and replied in a hopeful tone, yes. So from what I can gather, even though Wolff's law is taught in medical-based schools, it remains more of a concept about how the musculoskeletal system develops, rather than how the body can actually be transformed going forward. So this kind of thinking about the possibility of transformational self-healing, or with assistance from a therapist that can guide towards that, this kind of healing has never been part of the medical model. However, in structural alignment yoga therapy, we know it's possible. Point number 7, exercise has not been shown to prevent or slow the development of scoliosis. If the medical professionals are of the same mind that scoliosis is not reversible, then the intent behind prescribing the exercises is merely to alleviate pain by stretching hypertonic tissues and or to strengthen where needed. So they will not be creatively designing specialized exercise regimes to balance and treat each individual patient's unique musculoskeletal pattern. Typically, these exercises will be performed without attention to or knowledge of optimal alignment and biomechanics, and these exercises will be done within the context of the person's habitual misaligned patterns, the same pattern that created and contributed to the pattern in the first place. Whereas structural alignment yoga therapy is built upon the expectation, intention, and knowledge that the client, with the support of their therapist, can transform their condition. And we utilize specialized exercises that have the potential and the power to affect significant structural changes, which are designed to balance and treat each individual patient's unique musculoskeletal pattern. And we incorporate detailed biomechanics for optimal alignment and address the affected segment of the body as well as the whole body, including the compensation patterns. As structural alignment yoga therapists, we provide a unique form of yoga therapy that blends science with the subtle anatomy and biomechanics with the affirmation of the human spirit. And we're confident in the knowledge that the structural alignment yoga therapy comprehensive methodology heals the body of physical injuries, reduces recovery time from injuries, and prevents injuries from occurring because we are repatterning the musculoskeletal system. Point number 8. It may help relieve pain from scoliosis by helping maintain range of motion. Maintaining range of motion may be of relief. This is what I believe, because the surrounding tissues will be more pliable and able to move freely without spasm. And it allows the bones some breathing room, so to speak, providing space for the muscles and bones to potentially balance out their asymmetries. If they're in a more confined space, they're going to be more restricted. If there's more space, they're going to be less restricted. And in structural alignment yoga therapy, we have what's called the rubber band effect. So after we adjust the body towards optimal alignment in a person that has held a pattern of misaligned posture or an injury for so long it may not hold, or it may hold temporarily, then spring back to its original position, like a rubber band. So I've gone into more detail in my webinar, Structural Alignment for the issues of the feet and knees. So please see that webinar for a little bit more information about that, because it's relevant to all the different webinars that we're going to be holding. So just the one point about that, therefore our clients, with our clients, we are mindful that it's as important to work with the client's inner body, uplifting their spirit, as it is to work with their outer physical body. When treating old patterns, we make gradual, slow progress, and it's important to stay within a client's comfort zone. So what makes structural alignment yoga therapy transformational is that we have therapeutic alignment principles that refine and repattern the body towards optimal. We have specialized stretching and strengthening exercises that are designed to transform the musculoskeletal matrix. We have focused attention of targeted muscle groups and fascial patterns that creates a gradual and complete shift. So now we'll look at the formula and some transformational exercises for scoliosis. So the formula, SAT equals T. So we stretch and release the tissues around the bone so that they can articulate freely. We align this musculoskeletal system biomechanically with the therapeutic alignment principles, and then we tone and strengthen the new musculoskeletal pattern with appropriate functional exercises. And then for scoliosis, because of the asymmetries, we need to work within that as we align and tone to balance out these asymmetries and factor that into our therapy. So stretch and release the tissues around the bone so they can articulate freely. Some of these great exercises we know as cow cats. We inhale, look up, lift the tailbone, exhale, round the back. And this is opening up the tissues on the front and back of the spines, back of the spine. But we also want to include side bending and twisting. We want to move the spine in all 6 movements and work the tissues on all sides evenly as much as possible. Then once we've opened up all the tissues, then we want to align with the musculoskeletal biomechanical alignment principles. So first step is to establish and stabilize the thoracic spinal curve. Step 2, establish the lumbar curve. Step 3, to align the cervical curve. Why in this order, you might ask? So the reason why we stabilize the thoracic spine first, anatomically and biomechanically, the lumbar and cervical spinal regions are more mobile than the thoracic. So this means that because of the 12 ribs being attached to those 12 thoracic vertebrae, this is creating a cage, which is actually making it very stable. Whereas the lumbar and the cervical vertebrae above and below do not have the ribs attached. They're much more mobile. And so because of that, they're more susceptible to injury if they're either excessively flat or excessively lordotic. And because of this more delicate spinal area, the lumbar and the cervical, the somatic nervous system will not want to and should not want to release and allow a shift in the lumbar or cervical curvatures unless there is stability above and below, so above the lumbar and below the cervical, respectively. And also why we need to do the thoracic spine first, because it's the primary curve is represented here. The importance of this primary spinal curve, let's talk about that. In the womb, the fetal spine assumes the shape of the letter C, which is ideal as the most compact and protective position for the limited space inside the womb. The C is convex towards the back and concave towards the front, not C-shaped as in the lateral curvatures we talked about earlier, C towards the back. The secondary spinal curves, which are the cervical and lumbar, take shape within the first few months of life as the infant begins to lift the head. This starts to create the cervical curve, and as the infant starts crawling between the 5th and 13th month, it continues to develop the lumbar curve. So this is another reason why crawling is such an important part of development. Parents are too quick to try to hold the baby's hands and get the baby to walk. Crawling is very important. So do not encourage or try to push your child too quickly through that stage of development. And it's very essential to a really proper upright posture. So the primary curve remains in the thoracic and the sacrum, and this corresponds to flexion when we do a forward bend. And then the secondary curves are in the cervical and lumbar, and this is extension, which is corresponds also to when we do back bending kind of movements. So here's another picture of it. You got the secondary, primary, secondary, primary. They're alternating. So when the thoracic spine is stabilized towards the optimal alignment, which is that kyphotic curve, the somatic nervous system recognizes this as anatomical safe and psychologically protective. When the somatic nervous system feels safe, it will allow and will not resist the adjustment. So then once your thoracic spine is stabilized, then the nervous system will allow you to move the lumbar and cervical spines more freely and will not resist that because it has stability above and below. And the somatic nervous system is part of the peripheral nervous system associated with skeletal muscle voluntary controlled body movements. And this may explain why child pose is so soothing. It recreates the primary curve and mimics the safety and protection of the fetal position. Another thing we need to consider why we would do the cervical spine last is because it's the least weight bearing. So we would do the thoracic spine first. It's the primary curve, then the lumbar. We get that set up because this is where we're more weight bearing, and then we do the cervical. However, if there is a gross misalignment in the neck and head, such as forward head posture, this may limit the thoracic and lumbar spines from being moved. Again, that somatic nervous system is going to limit movement until we create a little bit more stability, and the forward head being so out of alignment may limit our ability to do that. So in this case, we need to get the head back as much as possible, and then we go thoracic and then lumbar, so we're working from the top down. So with scoliosis, the curvatures of the spine are lateral on the coronal plane instead of concave and convex on the sagittal plane. So the primary goal is to move the spine curves towards the optimal direction on the sagittal plane. So that is a big, overall guiding principle that we need to keep in mind. So to go back to what we were doing with the thoracic first, lumbar second, in Tadasana, seated or standing, we provide manual feedback. We cue the client to breathe and expand into the back body, into the thoracic area, right between the shoulder blades, and establish the primary curve. Then once that's established and stabilized, then we ask them to tip the sacrum forward and draw the low back in to create the neutral lordotic curve, and then we align the head and neck. So then we tone and strengthen the new pattern with functional exercises. So here's a great twisting exercise. We use the block to create stability, and we strengthen and tone the muscles on both sides of the spine. In structural alignment yoga therapy, we initiate the twist from the back body of the opposite side. And this is more calming and supporting for the nervous system. So let's talk about the spinal twisting. Whether you do it supine or sitting, the same principles apply. First, we establish the neutral curves of the spine, starting with the thoracic and then the lumbar, then the cervical. We stabilize the spine by drawing into the core. So I use the block in the supine pose, or here we can just draw in with, hugging everything in. And then we twist. We inhale. First, before we initiate, we do initiate the breath from the back body. But before the first breath, what I like to do is inhale and lengthen the spine to create space between the vertebrae. And then on the exhale, just start to move initially into the twist. So we're not going into the full cranking to the full twist. We're just initiating inhale, lengthen, exhale, start to move into the twist. Then we, next breath, expand into the back body of the opposite side. So you can see my hand is on Kim's left kidney, ribs, back body area. And she's turning to the right. So she's initiating, she's breathing into her left back body and then exhaling, turning to the right. And then but because we have convexity and concavities in the scoliosis, we're going to fine tune it and have them mold it with their breath as they go through that, and we give them tactile feedback to do that. And I explain that more in depth in the course, in the structural alignment yoga therapy course. But for simplicity's sake, it's we do that with our hands-on feedback, and we do it with the breath. And then we can do, this is a great exercise, spinal balancing with opposite arm leg raises. So we know this is spinal balancing, and we are toning the muscles on the opposing sides of the spine. And then again, we can fine tune it and mold it a little bit to work with the asymmetries of the client. And tailor it to each person according to what their body needs. So, for example, if they have less developed musculature and they have more concavity on their right lumbar, then we would do more work with their right leg to increase the muscles on the right lumbar side. And here we can actually give tactile feedback to transform the concavity and convexity in table pose. You place your hand on the area that's more concave, the one that's more indented or more collapsed, and you ask them to breathe and expand, and you actually give resistance so they can push into your hand. And then you place your hand where it's more protruded or more expanded, and you ask them to exhale and try to soften and relax and melt into this area. And you go back and forth between these two convexities and concavities, and you have them expand where they need to expand and soften and relax into. And so they're starting to get awareness from their inner body and how to use the breath. So that's some great samples. I hope that's helpful, at least to understand how we can approach it. Thank you for attending today's webinar. And if you've enjoyed this webinar, you'd be perfect for the Structural Alignment Yoga Therapy online course or the course that I offer in person, which is coming up soon. So in the Structural Alignment online course and in the personal course, we teach how to turn your passion into a reality to work in a therapeutic capacity and become an integral part of your client's self-healing. We teach you to elevate your hands-on and verbal skills with therapeutic alignment, to transform your personal practice and teaching into yoga therapy, and to begin to specialize in structural alignment yoga therapy. The online course has 10.8 hours of video lectures. It's an incredible amount of lectures spread over 66 individual lectures with detailed instruction. There's theory and principles, how to apply hands-on techniques for therapeutic optimal effect, how to assess posture. We talk about biomechanics, anatomy for each segment of the body. We talk about all the different specialized exercises and yoga poses for specific conditions, all with step-by-step guidance and details. And there's a 125-page workbook with images, theory, and instructions. The workbook and video lectures are downloadable, so you can access them at any time. It's a completely self-paced course. You start and finish as you wish. And after enrolling, you have unlimited access to the course for as long as you like on all devices you own. Thank you for participating in today's webinar. I hope you enjoyed this presentation. If you have any questions or feedback, I'd love to hear from you. And for additional webinars and videos, please check out my YouTube channel, Karen Claffey. I look forward to sharing with you again. Until then, I send you love and light.